Now, if you're sitting at a desk all day, you might be at risk of getting something called dead bum syndrome. Physiotherapist Aisling Frawley joins us now to discuss. Hello, Aisling. Lovely to have you here. What is it?
So they've described it as your glutes getting weak from prolonged sitting.
So your glutes are at your
bum muscles.
Yeah.
Yeah. So it's from prolonged sitting. You may have also heard the term gluteal amnesia. That's what I've heard in the clinic and stuff. So thankfully, it isn't actually your muscles dying off. It is just a case of they're getting weak.
Gluteal amnesia, they're forgetting what they're meant to be doing.
Yeah, they're forgetting. Yeah, and that can happen. Unfortunately, it's like a mind-body connection or mind-muscle connection. So we kind of nearly have to, I suppose, enhance it all of the time, or we will lose the activation in the glutes.
So what are the repercussions of not using your glutes as much or them being weak?
Yeah, so if you look at where the glutes are situated, like right at the base of the spine and in your pelvis.
Yeah.
So they hold obviously a lot of your kind of spinal stability, yeah, so at the bottom of your spine, but also they're major for activation, so sitting, standing, walking. So obviously if we're sitting all of the time and we're not using them, then over the course of the time, the strength in them is going to diminish and we're not going to be able to do as much as we want to.
Okay, so are the glutes, are they the bum muscle? Do they go the whole way around?
So they start basically at the base of your spine where the kind of your pelvic muscles are, and they wrap around to either of your hips, but they're also internal, so they're actually inside in your pelvis as well. There's tons of them. The main ones being like your glute max, med and minimus, but they're the three major ones around the back and the side of your hips.
Okay, so can it cause an awful lot of injuries if you've got underdeveloped glutes?
Yeah, for sure. I mean, things like you'll get knee pain. You won't exactly get specifically glute pain, but you might notice your lower back gets tight or stiff. You might notice your knees get sore. Maybe your hips are also sore, and you might notice it more so if you're active. So if you go on a run and you notice, oh, I'm getting a little bit of pain in my hip or my knee, it might not actually be the hip or knee. It might be the cause of the glute problem in general.
Right. Okay. Yeah. So it is, you might be treating something that isn't the issue.
That can happen. Yeah, 100%. It can happen. Yeah.
Okay, right. So if people are getting this sort of a thing, they have to be aware of it, obviously.
Well, sometimes you're not aware of it. I think it can manifest itself in pain. You know what I mean? So you won't actually know that it's happening until you go to do something, and then you figure out, oh, I've got pain in my knee or my hip. You may go and see your local physiotherapist and they say to you, it's actually not your knee, it's coming from your glute, because your glutes are the strongest and largest muscle in your body. So therefore, if they're not active and things that are, because I suppose, attached from that, if you think about it, the pelvis is the centre of the body and your legs are attached to the pelvis, then, you know, from the top down, you're kind of going to end up manifesting in pain elsewhere.
So is this something we've seen an increase of issues because of our sedentary lifestyle?
Yeah, I would say more than likely. I think we're sitting way more than we have ever done, and I think the prolonged sitting is the problem. I think the sitting itself doesn't necessarily cause the issue, but it's the time that you're sitting for. So if we look at our desk workers or people who are in the cars, driving, commuting, all those things, we're sitting way more than we have on an average day span. So we're looking at your hips get really tight on the front. It then elongates the glutes at the back. So then we have an inhibition. So at the way we can try and activate the glutes becomes less when we go to stand up, because our hips are now tight. So if our hips are tight, they're pulling our pelvis forward. So it kind of manifests in quite a lot of,
it's a system that's all connected. It's having a knock-on effect.
It's cogs in a wheel.
We're going to be looking at some exercises to help people out in just a couple of minutes with our fabulous models over there. But if there is someone who's right now, is there a lot to be said for standing up every once in a while?
Absolutely. I think, like for me, I try and tell patients, if you can set an alarm on your phone, try and sit and stand and sit at your desk, trying to get up throughout the day, even just your general basic movements at the desk, so trying to tilt your pelvis forward and back, doing your basic stretches. There's tons that you can do, but trying not to sit for, I suppose, 6 to 8 hours on a go is probably the...
So would you think, like, doing your stretches you remember from school, like stretching, do you think you should be doing those, like
absolutely.
In the office?
But
off
this
you
is
go.
the thing, like, I suppose when we talk about the mind-muscle connection element of it, so trying to be aware of what your glutes are actually doing. So if you're creating blood flow in and around that space, so by moving yourself around, because if we're sitting for so long, we're lacking in blood flow around that area. So it's trying to kind of boost that area over the course of the day.
Okay, when the Apple Watch tells you to get up, maybe
get up.
Physiotherapist Aisling Frawley, up and down, lads, up and down all day long. We'll go up and down, and they're going up and down over there. Are you going up and down?
Yes, thank you. Go
on.
We're here with Nathalie Lennon, who's going to teach us some exercises to help strengthen up the glutes.
Yes. What have you got? But he doesn't need it.
Well, he does.
You
Everybody
never know,
needs
he might, because I was very active. I was a runner. I was in the gym, and I actually kind of had this. I got the knee injury that Aisling was speaking about, and I went to see a physiotherapist who gave me these exercises because my glutes were weak, but the pain was in my knee.
Me too.
So,
Me too. And bad back as
Yeah,
well leads to as well. So
yeah,
yeah,
I've had that
absolutely
too.
very
Okay,
important.
So how do you strengthen them?
We're going to start off with an exercise called a clamshell. So the men have the bands on, and you can use these bands, but if you're just a beginner, you don't have to use the bands either. So we're going to get down on the mat for this one, guys, okay? So maybe we'll all lie on the same side. Maybe if we all go on our left hip.
You go in the middle there so we kind of see what we're doing,
so we're
right?
going to pop onto one side. You're going to lie down like so. Now you can stay up on one elbow. So you're going to stack the hips, you're going to stack the knees, 45-degree angle. You're going to keep the feet together, and then you're just going to bring that knee up and back
the bands
down.
are making it harder.
So that makes it harder. What you don't want to happen is you don't want to come back, you don't want to fall over. So you want to try keep your chest facing that wall and bring the knee up and back down. So that should really get the glutes firing, as we say.
So you would suggest to people, if they're only starting, not to do the bands because you
not
just...
using the band, yeah. And once you get to maybe 3 sets of 15 doing this clamshell, 3 sets of 15, then bring in the band once you feel you can do it well. But just be really careful to make sure your hips kind of stay facing forward and that they don't fall back. So once you get to 15, Alan, Tommy, can you feel a bit of a burn
I
with the
can
band
feel
already?
it, yeah. And then turn over to the other side.
And then you're going to pop over and do the same on the other side. Tommy knows these well, I'd say.
Okay.
So
But I haven't done them recently, and to be fair, it's...
I can feel it without the band starting to kick in.
It does get a real burn.
It
It's
does.
horrible exercise, but it's good to do.
But
I'm not getting a burn. Am I doing them wrong?
So I'd say...
There's no glutes there.
I'm not getting...
Do you know, you might feel it with the next one.
Okay.
So the next one is called a glute bridge. So you're going to lie on your back for this one. So on your back, feet flat to the ground.
Yeah.
Now, the main thing is to do this slowly. Don't fly it up and down. You're going to peel the spine up off the mat. And when you get to this point where your knees are in line with your shoulder, you should be squeezing the glutes a little bit and then come back down. Now, what I'd say is maybe bring the feet in a little bit closer to you guys.
Okay.
So not closer together. Feet are going to be hip distance.
Oh,
Yeah,
right.
and then you're just going to bring your
up
feet
to me,
closer
like this
in.
way?
Yeah,
Okay.
yeah, exactly. So from there,
So just get the
Go
hips up.
straight up.
pushing up and then back down. Brilliant.
Okay, go on. We've
That's
one
it.
more exercise. What's another one we
one
could
more.
do?
I'm going to get you from here to lie on your side.
Yeah.
Again.
Once more. So this one is the lying leg lift, okay? So if you're down, one hand can be out flat. Now keep the legs straight for this one. It'll be difficult with the bands. Yeah, that's it.
Feel
So
that
again,
one.
We're talking 3 sets of maybe 12 to 15 on either side.
Okay, so they're fairly easy exercises you could do on the living room floor, or
Most definitely. And I think people overlook the importance of them because they look so easy, but they really help keep those glutes firing.
If you do this what? So take 10 minutes every day?
I would say we might pop you up for the last
one more.
exercise. We'll
Okay.
get it in.
Oh.
I would say 2 to 3 times a week should be plenty.
Oh, 2 to 3 times a week?
2 to 3 times a week. I mean, if you're going running, if you're sitting down a lot, it's important to do them either way.
Okay,
So
last one.
Last one, guys, is going to be like a lateral crab walk. We're going to get down just a little bit. You have your band above the knees. Will we all maybe go this way and this way?
we'll all
So we're going to stay at the same height. We're going to keep our chest proud, and we're going to push against that band and take little steps, really little baby steps.
And as we do this...
We'll maybe do 5 and we'll go back. Or we'll be going into everyone. Now we'll go back this way. So we'll go back.
As we do
other
this,
way.
we're going to take a quick break, and Ireland will be back very shortly.
Good.